Hi, this is Jeff Garrett. It's the 8th of April, and I'm here today with Mitchell Blutz. Mitchell is a triple Penn alum, college undergraduate, medical school, and a Wharton MBA. He's now a clinical associate professor at the Cornell Weill School in New York, and he also runs Consonance Capital, where he's very closely involved in all aspects of the healthcare industry. So, Mitchell, welcome today.
Thanks, Jeff. It's a pleasure to be here and nice to communicate with all of you.
So let's start with the role of the private sector and what's going on in the US at the moment. Certainly, President Trump talks about it a lot. He talks about the private sector in testing, in developing therapeutics, the path to the vaccine. I know you understand healthcare all the way from biotech startups to big pharma. Could you give us your perspective on the role of the private sector in the immediate term with respect to the crisis?
Yeah, so the private sector is always deeply involved in diagnostics, in therapeutics and vaccines as sort of a subset of therapeutics, but it's been accelerated now, and the FDA, thankfully, and other regulatory bodies are cooperating to enable expedited activities. In the diagnostic space, diagnostic testing companies, not just in the US, but around the world, are making great advances in more efficient diagnostic testing for identifying the coronavirus that's responsible for COVID-19. And as everyone is hearing, there is a high volume of tests coming to the market and increasingly innovative tests coming from various companies, small and large. And the goal in these tests is to have sufficient capacity as well as rapid turnaround time of results.
So could I just interrupt you there for
please.
a second? So President Trump proudly touts the fact that the US has done more tests in total than any other country. That's true. But if you look at the per capita, the US is behind. Some of the European countries, Germany, even Italy, I think the US lags behind on a per capita testing. How much more expansion of testing do you think the private sector can support in the US?
I think ultimately the private sector can support all the testing needed in the U.S. The big question is how quickly. The corollary question is, what is the necessary testing? I, for one, believe that we have massive testing needs to get our society re-entered. And those testing needs will probably take the form of sufficient testing to enable citizens to have a passport or boarding pass or some concept that indicates that within the past 48 hours, they had a test that showed that they were not carrying the virus. And then once the antibody test, which measures immunity in people who've either had the infection and developed immunity, or once we hopefully have a vaccine, develop the immunity that way, probably both tests will need to be done in order to determine who's safe because they have immunity and who's safe because they're not likely to pass the virus on to someone. So if we do that, and we're doing that during the ongoing pandemic, potentially every 2 weeks, we're talking about massive testing volume. It will take many months to scale up to that level, but US pharma and biotech industry are capable of doing that. It's just the timing that I worry about.
Okay, and so that would mean that we could all feel more confident going back to work, going back to university, et cetera. And you think the timeline for those two, sort of lots of testing and testing for antibodies, that'll happen long before a vaccine is on the market?
Yes, I think so. The viral testing to determine if someone is actively contagious, we're actually almost at a level mostly from private industry. There are some state labs and municipal labs that are doing some of their own work, but mostly from private industry. We're almost now at a level to handle hospital-based patients. We're nowhere near the level necessary to handle the screening that we're talking about for everyday citizens who we're just trying to verify are either infected or not, or immune or not. So for the viral testing, industries, I think, mostly got U.S. hospital patients covered. We need a lot more to cover everyone else. For the antibody testing, they've just come to the market. We need many more tests, and that requires a blood test rather than a nasal swab. So we need people to interface with blood drawing locations to get that done. That'll take
Okay,
a
so
while. Before a
if we
vaccine,
pivot,
though, yes.
okay, so then let's pivot to the long-term implications. You know, two things that people are speculating about are the telemedicine and remote medicine that was always possible will now become a reality. But there's been a big challenge with respect to how the insurance industry deals with remote health. And then there is that broader question. Some people are also saying that because of everything that's going on now, something like a Medicare for All pathway is going to be, there's going to be more demand for that. Do you have a perspective on either of those issues, kind of remote medicine and what the crisis will ultimately mean for the structure of American healthcare?
Let me address the remote or telemedicine question first, and then I'll address changes in the delivery system and how the government's role is altered potentially. Telemedicine has been growing nicely prior to this crisis in the United States, but growing nicely meaning kind of 12% a year, 14% a year in some parts of the United States, hardly at all. It now is having in my view, is having its watershed moment. People are forced to use telemedicine in the United States and other parts of the world now. And what they're finding, and this, of course, has not been scientifically studied yet, it's too soon, but anecdotally, is that in many cases, they actually like it. They actually prefer it. They don't have to get in their car or on the subway and go to a health system location and wait in a waiting room. And besides being afraid that they might catch an infectious virus, they get very nice service. It's very convenient from their homes. They have a sense of more privacy. And when they're finished, they go back to what they were doing rather than having to commute back home. So for many specialties, primary care, dermatology, specialties that don't require the physical touching of the patient, this is becoming greatly preferred. Things like blood testing, of course, you can't do that in the home as easily, but there are companies that are advancing and have been for a while blood testing kits to the home so that you do have to end up getting somebody to stick a needle in your arm. That's usually not done at home. But long story short, this is the watershed moment. I think after the crisis is completed, we'll see a much higher market share of certain specialties of medicine using telemedicine.
And maybe even more so in emerging markets, right, where it's so hard. I mean, if you're in rural India and you've got to travel 150 miles on not great roads to get to a hospital to see a doctor, the possibilities online there are immense, right? It's not only older people in the United States. I would think emerging markets here could be transformative.
Yes, I agree. Although the place where the greatest traction had occurred in the U.S. and in some other markets of the world for telemedicine prior to the crisis has been in those rural communities where it was clearer to the family or the doctor that a 150-mile drive might not be necessary for a primary care visit or a dermatology visit, or for that matter, even for a psychiatry visit. And so that is the place where telemedicine already was getting traction. It's the place where the physician is just down the street that people are beginning to realize, hey, I don't really need to go down the street. I can do this from my home.
So the last question is about the structure of U.S. healthcare. And I just read, it's the 8th of April, I just read Bernie Sanders' I'm Getting Out of the Presidency address. And he made the point, you would expect him to make the point that Medicare for All looks more attractive today than it did before the crisis. Do you agree with him on that? What's your best sense of how the structure of the industry is going to evolve in the wake of the crisis?
So let me share my bias first so that students can understand through the filter of my bias. I'm not a Medicare for All fan in terms of my view of how it can best serve American citizens and their healthcare needs. I think the private sector teamed with the government with modifications to our current system can do a good job. What I do think, however, is that, and then I'll tell you where I think things are going, recognizing my biases. What I do think, however, is that in a crisis time, we do need to act with a Medicare for All modification during the crisis. And what I mean by that is that when emergency resources are needed in a crisis, we should act as one country, one set of resources, with allocation decisions of those resources being distributed where needed, rather than having states necessarily compete for resources. And so, we'll get through this pandemic crisis, but when we're in another national catastrophe that involves health of some kind, I do think we should borrow from some experiences that centralized healthcare or nationalized healthcare systems use in crises, because it's just inefficient to operate as multiple health systems in multiple states. In normal times, I think our system, with a variety of modifications, can do better than a Medicare for all delivery system. Where we go politically, will this get people thinking we should be more biased in favor of a Medicare for all program? I think that has to do with how the professors grade the United States healthcare delivery system on how we did during this crisis in the months that come. And right now, no one in the world is doing brilliantly. Everyone started late. The Chinese were able to use a much more totalitarian approach to seemingly limit their exposure once they recognized it. The South Korean government used a different approach. America is not likely to use those approaches, but we need to see how we get graded versus these other societies before I could make a prediction of whether our voters would be more interested in a centralized healthcare delivery system. My guess is they won't, but we'll see.
Thanks very much, Mitchell. That's a fantastic place to end, and thanks for your wisdom today. I really appreciate it, and I'm sure our students will too.
Thanks for doing this, and I wish my best to all the students as well.